Should I be taking omega-3 supplements? This is a question I often hear from individuals dealing with persistent pain. In fact, many of them have already started taking fish oil, having heard that it can help with various conditions like joint pain, arthritis, and fibromyalgia. But do they truly need these fish oil supplements that are rich in omega-3 fatty acids? I'll be addressing this and other related questions in today's discussion. So, let's dive into the topic of omega-3 supplements. Our bodies have a limitation. We cannot produce omega-3 fatty acids on our own. This is why they are classified as essential fatty acids, meaning we must obtain them through our diet. When we talk about omega-3s, we're referring to a specific type of fat primarily found in cold water fatty fish. Think of fish like salmon, mackerel, tuna, herring, and sardines. While these are the richest sources, smaller amounts of omega-3s can also be found in seafood, such as shrimp, oysters, and lobsters. The two main types of omega-3 fatty acids that are particularly beneficial for our bodies are EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. Don't worry about trying to pronounce these complex names. These are the specific omega-3s that are readily found in fish and seafood. For most adults, consuming just 2 servings of these types of fish per week is usually enough to ensure a good supply of both EPA and DHA. However, for those who don't enjoy eating fish or follow a vegan lifestyle, there are plant-based oils that contain a different kind of omega-3 called ALA, alpha-linolenic acid. Good sources of ALA include flax seeds, chia seeds, soybean oil, canola oil, walnuts, and dark green leafy vegetables like kale and broccoli. While ALA can be converted into EPA and DHA within our bodies, the conversion rate is quite low. Typically, only around 5 to 15% is transformed into a usable form. This means that individuals relying on plant-based sources need to consume significantly larger amounts of ALA to potentially achieve similar levels of EPA and DHA compared to those who eat fish. Interestingly, there are also some fortified foods available that contain added DHA and other omega-3s. These can include certain eggs, yogurt, milk, and soy beverages. So it's always a good idea to read the nutritional labels on these products. Now, let's understand why omega-3 fatty acids are so important for our health. Both omega-3 and omega-6 fatty acids belong to a group called polyunsaturated fatty acids. Omega-6 fatty acids are also essential, meaning we need to obtain them from our diet as well. They play crucial roles in our immune system function and in the process of blood clotting. There are several types of omega-6 fatty acids, including linoleic acid, LA, arachidonic acid, ARA, gamma-linolenic acid, GLA, and conjugated linoleic acid, CLA. Omega-6s are commonly found in foods like meat, poultry, fish, eggs, soybeans, corn oil, sunflower oil, nuts, and seeds. Here's a key difference. Omega-3 fatty acids are generally considered to have anti-inflammatory properties, while omega-6 fatty acids tend to be pro-inflammatory. It's important to understand that some level of inflammation in our body is actually necessary. It's a vital part of our immune response, helping us fight off viruses, bacteria, fungal infections, and even eliminate cancer cells that can develop and grow in our bodies every day. So, we do need some inflammation. However, problems can arise when there's an imbalance in our diet, where we consume significantly more pro-inflammatory omega-6 fatty acids than anti-inflammatory omega-3s. This dietary imbalance can create a tendency for the body to maintain a state of chronic, low-grade inflammation, which is not healthy. If we don't have enough omega-3s to counterbalance the effects of omega-6s, our bodies can remain in this undesirable state of ongoing inflammation. Unfortunately, in North America, the typical diet tends to be much higher in omega-6s compared to omega-3s. The average ratio of omega-6 to omega-3 in the North American diet is estimated to be around 25 to 1. Why is this the case? Well, one reason is that foods rich in omega-6 fatty acids often have a longer shelf life. These fats are more stable compared to omega-3s, which can degrade more easily. So, the next time you're grocery shopping, it might be insightful to take a look at the amount of omega-6s listed in the nutritional information of processed foods you commonly buy. For individuals with inflammatory conditions like rheumatoid arthritis, the ideal ratio of omega-6 to omega-3 in their diet is often suggested to be closer to 1 to 1. For healthy adults without chronic inflammatory conditions, a good target ratio is around 4 to 1. It's crucial to remember that the goal isn't to completely eliminate omega-6s from our diet. We need them too. The aim should be to achieve a better balance by increasing our intake of omega-3 fatty acids to maintain a healthier inflammatory response. For people dealing with chronic pain, a diet rich in omega-3 fatty acids may offer several potential benefits. Some studies suggest that it can reduce the need for non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or naproxen. It may also lead to lower levels of pain after surgical procedures. Furthermore, there's evidence that omega-3s can improve symptoms in painful diabetic neuropathy, nerve damage caused by diabetes. Some research even suggests a potential role in reducing the use of antidepressants and decreasing tolerance to morphine in certain situations. For individuals with rheumatoid arthritis, a higher omega-3 intake may lead to fewer symptoms. Women experiencing menstrual cramps, especially when combined with vitamin E, might also find some relief. Additionally, better function has been observed in people with knee osteoarthritis, who consume more omega-3s, and it may also help improve symptoms of inflammatory bowel diseases. These potential benefits highlight the importance of being mindful of our dietary choices and consciously working towards a more balanced, anti-inflammatory diet. It's important to note that the type of inflammation I'm talking about here is often not the visible kind, like the swelling and pain you feel when you have an inflamed tooth. We're primarily discussing microinflammation occurring at the level of blood vessels and tissues throughout the body. There are also other health problems that have been linked to a deficiency in omega-3 fatty acids. Some research suggests that it may contribute to high blood pressure, increase the risk of heart attack and stroke, and there's also ongoing investigation into its potential involvement in conditions like dementia, depression, and macular degeneration, an eye condition that can lead to vision loss. However, the studies in these latter areas are still considered inconclusive, and more research is needed to fully understand the relationship. Generally, my preference as a healthcare professional is to encourage patients to obtain the necessary nutrients through a well-balanced diet, rather than relying solely on supplements. However, if you do choose to take fish oil supplements to increase your omega-3 intake, particularly for pain management, a common recommendation is to take at least 1,000 milligrams per day. It's often suggested to look for supplements with an EPA to DHA ratio of around 1.5 to 1, meaning they contain slightly more EPA than DHA, to help minimize the unpleasant fish burps, which is that fishy taste you might experience in your mouth after taking fish oil capsules. Some people find it helpful to freeze the capsules and then swallow them just before bedtime. However, it's important to be cautious with high doses of fish oil, as it can potentially increase the risk of bleeding. Additionally, fish oil supplements may interact with warfarin, a common medication used to prevent blood clots. Therefore, it's crucial to discuss any supplement use with your doctor, especially if you are taking other medications. If you have any other supplements that you would like me to review in a future video, please feel free to write your suggestions in the comment box below. As I mentioned earlier, I already have videos available on other supplements like vitamin D, magnesium, and glucosamine with chondroitin. Finally, please remember that the information provided in this video is for educational purposes only and should not be considered a substitute for professional medical advice. 1. If you have any health concerns or are considering taking omega-3 supplements, it's essential to talk to your doctor to determine what's right for your individual needs. And in case of a medical emergency, please seek immediate medical attention. If you found this video informative, please give it a thumbs up. Don't forget to turn on the notifications so you don't miss any of my future content. And please subscribe to this channel for more health-related discussions. Thank you for watching, and I look forward to seeing you in the next video. Goodbye.